Start the clock. The next question, the member for Lanark, Frontenac, Kingston.
Thank you, Speaker. Speaker, my question is to the Premier. But first, I'd like to just congratulate the Premier on signing the deal with the Ring of Fire yesterday. Long overdue. Speaker, for the last 2 years, the Lanark County OPP have benefited from a mobile crisis response team. This funded a full-time mental health nurse to be a first responder alongside the OPP. The data is irrefutable. Early intervention works. Lanark County's situation table, which deals with individuals in crisis, has reported a 45% drop in referrals as a result of this pilot. But now the funding for the program has been cut, and I understand no evaluation of the program was ever undertaken. This program reduced pressures on our hospitals and our courts by solving problems before they became a crisis.
Question.
Speaker, will the Premier reconsider this poor decision?
The government to respond. I recognize the Solicitor General.
Thank you. We're both very anxious to answer it because it is a government-wide issue that we're dealing with. I'm sure the member opposite appreciates and understands that while we do not make operational decisions on how OPP distribute their assets and resources, there is no doubt that situation tables and mental health workers embedded with police has been a very effective tool. I have seen firsthand how situation tables can actually get the individuals who need the services quickly within their communities. But again, operationally, decisions made on where assets and resources should be deployed within the OPP are left to the Commissioner. Thank you, Speaker.
The supplementary question.
Speaker, let's not deflect from the question. It was the Solicitor General who eliminated the program. This was not an OPP decision. It's rare that we see success with such a program in such a short period of time. The MCRT has improved communications and the sharing of resources between our service providers and our agencies. It has eased pressure on the police, who don't have the specialized training in mental health and ought not to be expected to be mental health professionals. Early intervention has reduced those pressures on our hospitals and our courts. It was a win-win for everyone. But the Solicitor General did not even evaluate the outcomes before making the decision to cut and eliminate all funding. I'm calling on the Premier to review the details of this program and its success, and then direct the appropriate ministers to reinstate funding. Thank you.
The Solicitor General to reply.
So to be clear, 40% of frontline police officers' work today in the province of Ontario, across Ontario, involve individuals who are in crisis with mental health. It is, frankly, why our government has such a government-wide focus on actually getting the services where they need to be across Ontario. The operational decisions are made by the Commissioner and his team. What we are doing at government-wide is to make investments that actually impact individual lives, and those investments continue to happen through the Minister of Health, through the Associate Minister of Health, and across government. Thank you, Speaker.